In a recent article written by IPASS faculty and published in the journal Addiction, it was reported that an estimated 4.9% of the world's adult population, that's 240 million people, suffer from an alcohol use disorder, 7.8% of men and an estimated 1.5% of women. It's easy to think that since alcohol is legal in most countries, that it isn't very harmful, but these data tell us otherwise. It was also reported that almost 1/4 of all adults in the world, that's 1 billion people, smoke tobacco products. Again, more men, about 32%, than women, only 7% of women. And 11% of all deaths among males are due to tobacco products. So how do we know all these things? How do we know what the burden of alcohol use is around the world? How do we know that men are affected more than women? We use research of populations to answer these questions. Through this research, we can identify how substance use and abuse affects the public health of different cultures and communities around the world. This is the kind of thing we'll talk about in the Public Health Issues and Approaches to Addiction module. We will learn things such as who drinks the most? How old are they? What do they look like? Where is it that secondhand smoke really causes the most health problems? Why is opium use so frequent in Asia? And why is prescription drug use on the rise in the United States? And is cannabis really the most frequently used illicit drug in the world? The United States National Institute for Drug Abuse reports that drug abuse is a major public health problem that impacts society on multiple levels. Directly or indirectly, every community is affected by drug abuse and addiction, as is every family. Drugs take a tremendous toll on our society at many levels. So what does it mean to be a public health issue? What is public health? Public health is a science that focuses on populations rather than individuals. The focus for clinical medicine is the individual. In public health, we consider the health of a community or an entire population. Clinicians are taught how to assess the health of individuals. This module will introduce you to the tools used to assess the health of a community or a specific population. We do that using the tools of epidemiology. We will learn the basic methods of epidemiology, and by the end, you will be able to understand the vocabulary, apply the basic tools, and interpret their meaning. These skills will help you assess the health of your community, determine whether a new treatment may be right for your clients, or decide whether or not you should implement a brief intervention strategy so that you can identify any patients who may need a little extra help. Does alcohol use during pregnancy make a child less intelligent? Is there anything we can do to prevent youth from trying drugs? Is heavy cocaine use really a risk factor for heart failure? These and other questions are studied by conducting surveys or enrolling people in research studies, such as longitudinal cohort studies that follow individuals over a period of time, or maybe a clinical trial that compares different treatment modalities. Some of the things that we will examine in this module are the distribution of drug use and its consequences around the world. We'll look at different study types that can answer different types of questions. We'll identify what risk and protective factors lead some teenagers to use drugs and others not. How does addiction affect families? Is it related to domestic violence? And can family conflict lead family members to become alcoholics? And primarily, you're going to learn how to read and critique the medical literature so that you can understand and use the scientific evidence that can help you either treat a client, select a prevention strategy, or develop a substance use-related policy. There's some key things to remember about this module, though. Because it's all online, you can schedule your life around it, and that works well. But also, because it's all online, you do have to be disciplined and organized. When a concept isn't clear, you have to go look for answers, and if you don't find them, ask. because there's a lot of material in this class. So in this module, you'll walk away with a better understanding of public health issues as they relate to addiction. You will learn to separate the myths from the facts using proven data, research methods, and critical thinking.